Good morning, everyone. Good afternoon. So I'm happy to moderate this session. I will also be demonstrating in the session. I'm Dr. Ricky Smith from South Africa. It's my first time in Morocco, and it feels really amazing to be here. But we're starting the session first with Dr. Malik from Manchester, United Kingdom. He's an aesthetic physician and also hair transplant surgeon, and he's going to do an amazing practical demonstration on neck rejuvenation with polycaprolactone. He's also a trainer for Gauri, and he's also going to show some other regions of the face and the hand in the rest of the Congress. But now will be the focus of the neck. Thank you. Are you ready, Dr. Malik?
Alors maintenant, c'est la société Skin Edge qui va injecter avec Gauri. Gauri, c'est un inducteur de collagène. Et donc, normalement, il nous fait le cou, les mains et le visage. Mais ce n'est pas possible de faire tout ça aujourd'hui. C'est un vrai marathon. Je ne peux pas vous dire, j'ai déjà les pieds en compote. Et donc, on va faire le cou. Alors, je vous disais que c'était un inducteur du collagène. Et on va faire, normalement, il fait le cou, les mains et le visage. Mais comme on ne peut pas faire tout ça, on va faire d'abord le cou. Ce matin, l'après-midi, on fera les mains. Et demain, on fera le visage. Donc, c'est la société Skin Edge avec un inducteur du collagène, Gauri.
Hello everyone, this is Dr. Malik, and I'm very excited to be here in Morocco, Casablanca. And today I'm even more excited to bring you Gauri. Gauri is the world's first liquid PCL, and I'm going to be demonstrating how to approach the necklines and the area of the neck for the skin tightening and the rejuvenation. I'm going to be also talking about this on Saturday as well in detail, but today we're going to talk about the protocol and how to approach in this particular scenario. Before I talk and show my demonstration, I would like to emphasize on the fact that as we age, the collagen is being lost, and the collagen loss is actually causing the laxity of the skin to be like this. So what we are trying to achieve is, we are trying to get some tightness to the skin by bringing some thickness by collagenesis. And this is where Gauri plays a very integral part. Gauri is very unique because it doesn't have any particles in it. So it's free of particles which can cause vascular occlusion, granulomation, and in this scenario, it makes it very, very easier for us to administer something like Gauri for any area on the body. But right now, as we are approaching the neck, the element that is completely liquidized, it actually spreads about 4 centimeters from where you inject automatically. So what we are going to try and do today is inject in a 3-vector scenario with the cannula, with a retrograde linear technique, and achieving a spread of the product. Once we have achieved that spread, it's going to slowly dissipate into the rest of the area and cause the full collagenesis of the area as well. So I've already disinfected this lady's neck. She's a lovely lady, Asia, and she is going to be our model for today. Right, so first of all, the element of marking. So the patient has to be sitting up when you're marking the, any area when you are treating that. So I like to mark some of the major elements which I'm going to be taking into consideration, the area that I'm going to be injecting in between. So sternal notch, which is around here, and mid of the chin, which is around here. So if I draw a straight line between these two, as you can see, look up please for me. So there's a straight line in between these two. Now you can again ask the patient to look to one side and look down. So you can feel the sternocleidomastoid muscle. So I can feel the sternocleidomastoid muscle, which I'm going to mark here. Similarly, I will ask her to look down and look this way, and I can feel the sternocleidomastoid muscle, and I mark here. So now if she looks up, you can see we've got the sternocleidomastoid muscle marked, mid of the chin, and the sternal notch marked. If I had to take a midpoint, which would be around about this, this crosses the sternocleidoid here, sternocleidoid here. They become our entry points. From these entry points, we are going to be approaching towards the mid of the chin and towards the sternal notch. So that would give us a diamond-shaped element that we're going to be injecting in. So I call it diamond because it's a bit like this. Avoid any obvious blood vessels that you can see in the neck area. That's not that important, but in the hands we always have to take care of the fact that there are no obvious blood vessels that we are approaching. In the neck area, the skin is a bit more lax, and also sometimes it can be tricky in terms of getting the cannula in. So what I like doing in the neck region is to make a bleb with lidocaine. So what I do is, after I've cleaned everything, I use a bit of lidocaine, make a little bleb that raises the skin up. When I'm using a trocar, I'm actually avoiding any underlying tissue, underlying structures as well. And once I've done that, then with the same cannula, I'm going to be injecting 1 ml of Gori on one side and 1 ml of Gori on the other side. So that is the element that we're going to be looking at. So can you lie down for me, please? So quickly, coming to the product now, I'm going to show you how the Gori product comes. So it's a fully prepared 1 ml syringe that comes in. And as we can see, this is how Gori comes in. Gori is completely homogeneous, whitish liquid. It's all comes pre-packed and pre-prepared. You don't have to do any preparation. Thank you. In terms of cannula, we are using a 25G, 50 millimeter cannula. So that comes with the trocar itself. So what I like to do is this. I take the trocar, I connect it to the Gori syringe like that, directly. And I take 2% lidocaine, and I just get about 0.2 mils of this lidocaine into the Gori syringe. Now, because it's a homogeneous mixture, you don't even have to shake it much or do anything with it. It actually mixes automatically. So even if you want to have a bit of a peace of mind, you can actually just do that, and that's enough for it to get mixed. So this is now ready. I'm going to get the other Gori ready as well for the other side of the neck. So again, the same process, getting the syringe out. It comes with a cap goes off, and we connect it like this. Okay, once we've connected, again, we are getting about 0.2 mils. Now, you might question me, why 0.2 mils? The reason is, it makes the maths easy. So if you have got 0.2 mils, it makes 1.2 mil in a syringe. If it's 1.2 mils, that means 0.4, 0.4, 0.4. 3 vectors will be equally divided for every syringe. Okay? So now they both are ready. Going to connect the cannula on. So this is now lidocaine mixed with Gori and the 50 millimeter cannula connected. Just before, to make a bleb, I get an insulin needle, and for insulin needle, I get a little bit of lidocaine in the insulin needle because that's going to make the initial bleb. That's what I need. Right? So now, as we mark our entry point round about here, I'm going to pinch the skin up a little bit. You see, it's sometimes a bit hard. So ask the patient to look down a little bit, and then you can pinch the skin. And as we are pinching, you can see the tip of my needle. I'm going to make a bleb. You can see this round raised area. That's called a bleb. So that now I can feel. It's also numb as well. So, so this is going to be the entry point area. Once I've done that, I take the trocar and I gently pinch, and from the same entry point, I go in. So we are going subcutaneous, subdermal sort of level, nothing much more deeper. And when you're coming out, especially with the neck area, because there's going to be a lot of lax skin, I give a side flick with the bevel of the trocar. That side flick slightly opens it a bit more further and makes it easier for me to insert the cannula. So now, as you can see, it was an easy slide in there. Can you just look to this other side? Okay, so I'm going to approach the most difficult element. Sometimes the shoulder comes in between when you're doing this, and you can always put the patient down a bit more further. So I'm going to just move it down a bit, the head down a bit, head down. Yeah, perfect, that's it. Camera is okay? Perfect. So now, as I have put the head down, it gives me a bit more maneuverability, and I can feel the tip of my cannula going up here, right? Perfect. So as I am here now, I'm going to inject 0.4 mil in a retrograde linear fashion. I'm going to start injecting, and as I'm injecting, I'm coming out. I'm coming out, coming out, coming out. It's very swift, very easy to inject. It's not as thick and viscous as a filler. Now I go and approach from the same entry point in the mid of the neck. Now she can see straight, and I can see the tip here, if you can see, all of you. And I'm approaching this middle area, and I come out with injecting 0.4 again. The key is that I try not to inject near the entry point, because that's the only area where you have caused a bit of a bleeding, and you because of the making the entry point. So you do not want to mix the blood with the product. Now I will go and approach in terms of toward the sternal notch. As you can see, it's going toward the sternal notch now. I can feel the tip, and it's in there, and my last 0.4 mils go smoothly like that. So that one side is completely done. Now the same. There you go, thank you. Now we're going to do the same on the other side. I normally use arnica gel or something for the entry point, just in case of any bruising. Sometimes that can happen. So if you can look this way for me, please. I'm going to make another entry point on this side. And so pinching the skin, and as you can see, a bleb has been made. The bleb always helps and makes it a bit more easier for the patient to take it. Another question that you might ask me is that why have I put lidocaine with the product? So technically, I've done a lot of procedures without adding lidocaine as well. But because it's liquid PCL can slightly sting when you are injecting, so I'm trying to avoid that and making it a much more comfortable scenario for the patient. So I can feel the area of the bleb where I've gone in. I make an opening, and I flick a bit to the side. Sometimes the holes are so small that you can't even locate them once you have done it. So now again, with a cannula, we have got in, okay? And we're going to approach the vector toward the mid of the chin, and just subcutaneously going through, coming out, 0.4 mil injected, perfect, and now going towards the mid of the neck. So now if you just look here. So sometimes if there's a bit of resistance, you have to just recalibrate your cannula. And as you can see, it's a one-hand procedure, just coming out smoothly and swiftly. It's one of the easiest procedures to do. And in my clinic, almost everybody is a gory patient, because collagenesis is for everyone, for all ages, for all sort of clients, everybody wants it. So it can be an adjunct or a standalone treatment in all the scenarios. Now I'm doing my last vector, and as you can see, within 5 minutes, you have done a whole area. So we have injected 1 mil on one side and 1 mil on the other side. So because it's a collagenesis scenario, we are going to inform the patient of the fact that there could be slight bit of edema and redness in the area, which she has got nothing to worry about. It's self-diminishing. It's going to resolve within a day or two. And that's it. So this is all the neck gory done. Thank you very much.
Thank you, Dr. Malik, for this amazing demonstration. I will ask if there is some question because we have 5 minutes more. Est-ce qu'il y a des questions dans la salle pour ce produit?
Alors, merci, Dr. Malik. Merci à la société Skin Edge. Et donc, on va passer à la prochaine démonstration. Je voudrais profiter de ce petit vide pour vous parler d'un événement qui aura lieu en mai. Vous aurez les comment on va appeler ça? Les fiches, elle va les distribuer tout à l'heure. C'est mon ami le docteur Aqlal Nadia. Elle est présidente du FLP. FLP, je ne sais pas si vous en avez entendu parler, c'est laser Maghreb. C'est la formation laser Maghreb. Et chaque année, ils le font dans un pays, c'est-à-dire la Tunisie, l'Algérie. Cette année, c'est le tour du Maroc. Et on voudrait que vous honoriez les Marocains et mon ami Nadia par votre présence. On aimerait que ça soit une réussite, comme c'est une réussite d'ailleurs, et j'ai déjà assisté en Algérie, en Tunisie, c'est une grande réussite. J'espère qu'au Maroc aussi, ça sera une réussite. Nadia vous distribuera les fiches pour y assister. Elle nous a même fait un prix qui est vraiment... je ne sais pas si je vais le dire au micro, Nadia. Je peux? OK. Alors, c'est 800 dirhams. 800 dirhams et vous avez les grands experts du laser. Et vous savez que les Algériens et les Tunisiens sont de grands experts en laser. Voilà, ceux qui veulent y assister, elle va distribuer des fiches et vous pourrez appeler le contact qu'elle a mis sur sa fiche.